When starting the straight cath on a female patient, you would review your orders, obtain your supplies. I would then go to the patient's room. I would wash my hands and introduce myself. I would assess the patient after I had verified the patient's identity using the wristband and verifying name and date of birth of the patient. I would explain the procedure and ask if there's any questions. I would ask if the patient was allergic to shellfish, and then I would ask the patient's family and friends to leave, providing privacy, and I would check for adequate lighting, and I would then perform proper body mechanics by raising the bed. For the patient, you would place the patient in a dorsal recumbent position. I would get assistance if needed. I would then organize my work area. I would take my non-sterile gloves and put them on. And I would then clean the vagina, starting on both sides, using a new side of the cloth each time and then down the middle. I would then remove my gloves and wash my hands. Starting the procedure for a straight cath, you would open your cath kit and making sure only to touch the sterile gloves. During the straight cath procedure, you would open your cath kit and then remove the sterile gloves, making sure only to touch those. I would then don my sterile gloves. I will then use this to expand my sterile field. I would then remove my cup and set it to the side. And take my drape, shiny side down, and I would place it under the patient, giving assistance if needed. I would then take my fenestrated drape, shiny side down as well, place it over the peri area. I would then remove my supplies. And then I would empty the lube. And then I would get assistance from my fellow coworker and take the catheter, and I would lube the cath 1 to 2 inches, and then I would spread the labia and ask the patient to bear down. I would insert the cath 2 to 3 inches, and then additional 1 to 2 inches once I met resistance. Once the urine has and then put the urine into the cup, and then empty the rest of the urine for my assistant into the basin. then once the urine has decreased, I would stop it. And then I would discard the cath. Ask the patient to relax and remove the cath. If the catheter had been placed in the vagina and not in the urethra, I'd grab a whole new kit and start over. I now have my urine sample in the cup. I'll put my lid on, take my label, write in the patient's name, date of birth, and order, and put it on. I then take my biohazard bag and place it in the bag. Take my order, put my order in the back of it, and then I would send this off to the lab. I would then measure the urine in the basin and then empty the rest. I would then remove the drape, and then with assistance I would remove the seal. And then I would provide pericare again, and then I would return my patient to their comfort and safety. So I'd lower the bed. I would then put the table beside them and make sure the collar was in reach. I would have then remove my gloves and wash my hands. And I would actually have done the urine sample after I had returned the patient to comfort and safety and then sent it off. And then after that, I would document the procedure and assess the patient and make sure that they are okay.